Welcome back to Primetime News.
And a special welcome to those of you watching on onespotmedia.com.
First up this evening, the Health Minister, Dr. Christopher Tufton, has confirmed that there is a worrying spike in COVID-19 cases across the island.
He gave the confirmation during a statement to the House of Representatives today.
As Sandy Williams reports, the minister is putting Jamaicans on alert for other respiratory illnesses that have been circulating.
Jamaica's positivity rate for COVID-19 has increased. Health Minister Dr. Christopher Tufton said the spike was noticed following recent tests. However, there are some anomalies with the number of positive cases detected.
Generally speaking, remains relatively low. Over the past 4 weeks, there have been an average of 87 confirmed cases. The number of cases are not increasing. The average 7-day positivity rate is about 22%. I know there's 17 on the statement, but it's actually about 22%. Now, this is clearly higher than what we would like to see. Ideally, of course, none, but on average about 5 or so %.
Dr. Tufton has attributed the uptick in COVID-19 cases to the Omicron variant, which is highly transmissible. But opposition spokesman on health, Dr. Maurice Guy, is concerned about the accuracy of the data.
In your report here, you indicated, and I will read, the last batches of genomic sequencing done on samples collected in March and April showed its subvariants XBB .1.5 and BQ.1.1 were most prevalent. Minister, we have many genomic sequencing machines in this country. We ought not to be having samples reports that are still dated from samples in March and April. We are in the month of June now. Genomic sequencing takes about not more than 5 days to get back a result. So I would have expected the minister to come and tell the House that the latest genomic sequencing that we have at the ministry was for some time like last week or the week before, not 2 months ago.
I take the point. I will say that we do have current data, and we have current testing numbers right up to July. In fact, I'm looking here at UI's numbers. Up to July, 49 tested, 6 positive, 43 negative, 12%. June 65, 16. June was 25% positivity. So the University of the West Indies, persons who come in to A&E, they are automatically tested once and they have up to current.
Since the onset of the COVID-19 pandemic, Jamaica has recorded a total of 155,455 confirmed cases and 3,586 COVID-19 related deaths. COVID-19 aside, according to the health minister, there is also an uptick in influenza cases. It's why Dr. Tufton is urging Jamaicans to take precautions.
Admissions for lower respiratory tract infection, pneumonia that is, were higher than expected in the last 2 weeks. We usually see about 100 to 120 cases each week. We are now seeing a slight increase with numbers up to about 124 cases or so, 24, 25 each week. So slight uptick in pneumonia. Again, the public is reminded that persons at both extremes of age, persons with comorbidities susceptible to severe respiratory infections caused by many different viruses, same precautions that are advised for COVID-19.
Sandy Williams, TVJ News.